Well, officially, good evening, everybody, and welcome to our Thursday evening science discussion. We have a couple of guests to join us tonight. We're excited to have them when these opportunities come up where we have a chance to do a deeper dive and a dialogue on the science and the discovery and the breakthrough of what we sit in front of. There's just something special that happens when we have the ability to take science innovation at its finest and have it intersect into the marketplace and have a group of a community of people who come together on a common cause to share this information. If you're a guest that are joining us tonight, we welcome you. My hope for you is that you can get the information you need to make a good decision on how this may work for you. We use the term just try it. We all have active lifestyles, and I don't care what background you come from or what your age demographic is. I think it's safe to say that we all want to be able to move freely. We want to be able to do that in a way that we can enjoy the longevity that life has to offer us. And my hope for you is that you find great value in this product as I have, and those around me have experienced it. It's been a wonderful experience to share this product out. We're going to have a conversation from two incredible individuals that have been at the forefront of the science of LactiGo. I'm excited to introduce Chad Macias, who is our Chief Science Officer, as well as Tim Sharpe, who is the Director of Research and Development. They both come with deep backgrounds in science and research, as well as these guys have spent a lot of time working with the product with other folks and in the study platform, as well as athletes. So we're excited to have Chad Macias. I'll have him jump on first. In fact, why don't we start out, if it's okay with you two gentlemen. We're going to have Chad and Tim join us and just give us your background and how you were introduced to LactiGo. And then we'll start with you, Chad, and then we'll bounce it over to Tim. So let's cut loose. Chad, and let me just kind of key this up to a little bit, just for those of you who don't know Chad. I know many of you are just getting the story of LactiGo and may not know who Chad is. Chad is a two-sport Olympic athlete with Team USA. He's worked with high-level athletes. He's trained them and worked with special forces, with the Navy SEALs, in the military. He's taught functional medicine at the University of Western States. He's got just a great deep background on, he's considered a human expert or human optimization expert. We're excited to have him here as he's been learning about the value of LactiGo, and also he is a molecular physiologist. So he has just a great resume. He spends a lot of time in the research laboratory working with Tim as well. So Chad, we'll start with you and then we'll bounce it over to Tim, just to give us a background and how you were introduced to LactiGo.
Yeah, thanks for the warm introduction there, kind sir. So yeah, basically, I've spent majority of my career studying molecular physiology, molecular biology, and then translating that into practical applications, both with elite athletes and then also in the lab in the biomedical research space. And so that's where I ran into Dr. Tim Sharpe in our circles of scientists and researchers. We became friends, then we became colleagues. That was prior to my intersection with LactiGo, which would have been in 2014, is when I became LactiGo. And it was introduced to me by a UFC fighter by the name of Jeremy Stevens. And that began, my well-documented journey where we used the product with elite athletes like Usain Bolt and Brittany Reese and Dalia Muhammad and all kinds of other athletes in different sports, and then realized the power of recovery, then realized the power of what carnosine can do in the body for general health and wellness. And that's what started our last 11 years of, publishing 4 research studies, making sure we had patent protection on the IP. Tim and I developing, lots of different new products based around our delivery system. And so that's what the last 11 years has looked like, based around what started in late 2014.
Excellent. Thanks, Chad. Let's bounce this over to Tim, which, by the way, we're grateful to have him when he has a chance. There's a lot of great information that we're going to get out of him, and we're just always grateful when he has a chance to join us. Tim, we'll send it over to you. Your how you were introduced to this, and a little bit of your background as well.
Yeah, great. So yeah, I started as a clinician about 20 years ago. I have a doctorate in Oriental medicine. I have a master's in human nutrition and functional medicine. Um, I uh, I taught sports nutrition, nutrition in general, gastrointestinal pathologies. Taught lots of stuff to graduate students over the past 10 years or so. I just actually left the university last year. Started practicing 20 years ago with nutrition and Chinese medicine practice. And I've opened my own private clinics. I've practiced internationally in multiple countries. I've practiced in China, I've practiced in Thailand, practiced all over the United States. And I guess my introduction to LactiGo was when Chad had mentioned it to me because we wanted to study it, and so I came in maybe early 2016, not really affiliated with the company at all, just as a friend and colleague of Chad's. I'm his sports nutritionist for all his athletes. Um, and so we started studying it, which became the first paper that we published in 2016. And that kind of snowballed into us getting involved with the company. We then eventually co-wrote the patent and have been working on product development and understanding, you know, as much as we can about the possibilities of LactiGo and of different places that we can take this product and future products.
Excellent. Thank you for that, Tim. So let's dive into this. I know we've got guests that are on that are getting this information for the first time. They don't know what LactiGo is. Maybe let's just start from a very, very basic level. And Chad, if you could just share what is LactiGo exactly? What would it be expected? Like when people get this gel, and is it just like this something you put on that helps address issues with pain, or yeah, what would be something that you would explain in just a very simple way that would tell what LactiGo is? What is it?
I mean, you just said it. The one of the easiest ways to look at LactiGo, the menthol product specifically, is a topical analgesic. It's a topical painkiller, and people can expect to see those type of benefits from multiple different types of pains, aches, and pains that they would experience on a daily basis from prior injuries, from back strains and different things that you may experience from joints and muscle aches. And so it can provide quite a bit of relief for people in that regard. And carnosine is also very well documented in the scientific literature to have very potent effects in the body based upon what it's understood to do as an anti-inflammatory, helping with anti-glycation end products, chelating heavy metals like copper and zinc, as well as being a very powerful and protector of the nervous system, as well as being a neurotransmitter, very, very powerful antioxidant, even to the likes a greater degree than glutathione, which most people are familiar with. So it's a very powerful neuropeptide, and it has multiple different functions within the human body as is expressed and produced naturally within the body. And so it does a lot of different things for overall health and wellness. And we have a product that can help mitigate pain and help people get through the day, move, function better, perform better in sports, recover better from sports and hard training, recover better from general life, whether you're just a parent that's got to pick up your kids 15 times a day, you're running around nonstop, not getting the food you need. So there's a lot of potential for what LactiGo and how it can be applied and what it can do for the average individual all the way down to Olympic athletes.
Tim, anything to add on that?
Uh, I guess the only thing that I'll add is there are the things that we can say because it is a supplement, and you're limited based on what your actives are. So, Chad mentioned the menthol, and he talked about the analgesics. And then there are the things that a lot of people use the product for that we can't really talk about. But one of the things that I would encourage people to do is to get cozy with the carnosine molecule. Like, I shouldn't say molecule because that immediately turns off a bunch of people, but the concept of carnosine, just Google things like, what has carnosine been shown to do in research? Like, there are so many things that if we weren't shackled by what you're actually able to say about a product, that we would say about the potential of this product. So we'll say lots of great things, but do a little bit of digging and you'll see so much more than even what we'll say on this call.
I want to ask a question since you brought up carnosine. Can we go into what is carnosine? We know that there's two active ingredients that it's in LactiGo. Can you give us a breakdown or what is carnosine exactly? Why is that important for us to have in our body? Do we already have it? And how important is carnosine?
Yeah, it's massively important in the human body. It is essential for our existence for so many different cellular processes. The list would be too long to cover in this call, because there are so many different ways that it interacts. Carnosine does with the human body at a cellular level. As I mentioned earlier, as an antioxidant to prevent anti-glycation end products, and the benefits of the simplicity of an antioxidant or a chelator of heavy metals or some of these things that we conceptually talk about, that have been well, you know, kind of flushed out in the scientific literature when it comes to carnosine. It's just super important. It's produced primarily in the skeletal muscle, and then in the cerebral spinal fluid and into the brain cavity itself. And so there are limitations in where carnosine can move and go throughout the body, but there is almost no limitation in how beneficial it can be to the body. So it's simply a matter of figuring out a way for carnosine to be an effective tool, for human movement and general health and wellness, and that's where topicals close the gap. And so, there really is, you know, there are certain things that if you were to remove them from the body, we would perish almost immediately. Carnosine would be one of them. I mean, it's that important to all the different cellular processes, and it's the only thing that we've really observed that has direct access to every cell type in the body. Extremely strong carriers through, to get it through the membrane, or just direct access through those cell membranes. And so, that kind of makes it a unique player, within the human body, where, it's almost like acting as if the way the immune system would, in that it can seek out things that aren't right, and in many different ways and in many different cell types, and it can impact what's happening to bring about a better state of homeostasis or a better balance within that cell, to prevent it from becoming toxic and all the things that lead to, inflammation or advancing the aging process, reducing telomeres, things of that nature. Those are all the byproducts of when we have too much going on within the cells that is unmitigated. And so carnosine is very powerful in so many different ways. And as Tim mentioned, there is thousands, literally thousands of research studies published on it, in all the different areas that we're talking about.
And I'll add to what Chad said. Those of you at least that are new here may be thinking to yourselves, "Well, this sounds great, but why haven't I heard of carnosine? I'm here because somebody brought me in, or I know somebody, or maybe I tried it and I felt great, but I don't know what's going on." And the simple answer is carnosine really doesn't perform well when it's taken orally. There are a lot of challenges that oral carnosine faces. It doesn't survive to get into circulation once you go through the digestive process and it hydrolyzes. Once it breaks down to the point where it could get into the bloodstream, you've already lost most of your access to carnosine at all just through that process.
Mm.
And then there's an enzyme in the blood that breaks carnosine down and makes it even more difficult to get any kind of meaningful dose of carnosine when you're taking it as an oral supplement. So there certainly are research papers with oral carnosine, and thankfully those exist because those are some of the things that let us know what some of the capabilities are. But now that we have this topical application of carnosine that faces literally none of those same challenges that you face when you try to take it orally, we can really see what the potential is. And the likelihood of us seeing some of these results that they see in a lot of the lab testing they did, where they used like dosing methods that were so high that you actually did get active amounts of carnosine. We don't have to do that with topical. We're able to get like demonstrated through skin testing, through muscle biopsy. Like we know we are delivering carnosine. Like there is absolutely no question. And now we get to witness all the things that come with being able to deliver a molecule as powerful as what Chad described.
So on that topic of how important this is when you look at a topical approach, what would you recommend someone like how they should use it? Is this something that they would only put on? Is it once a week? Is it only when they feel discomfort they should put it on? How often and where would be best applied? And that would go to either one of you. Tim, let's start with you, and then we can bounce it to Chad.
Yeah, I was gonna
Okay.
say Tim usually frames this a little bit better than I do, even though we're saying the same thing. So let him run with this one a little bit, and I'll add anything that is relevant.
Yeah. So, um, as a clinician, I always start with the question, what is it that I'm trying to achieve? Right? You never start with the protocol. You always start with what is it that I want to get out of the thing that I'm doing. So that's the first question that I would ask. So, um, if I had knee arthritis, absolutely, I would put it on my knee for sure. But I would put it on much more of my body than just my knee. So I would do much closer to a full body application at least once a day for that. But I would spot apply on wherever my issues were. If this was a specific like focal pain issue. So if and actually I have an injured knee right now, so I'm putting it on my knee typically like 3 times a day, and then more of a full body application probably around once a day. If I was using it in either an anti-aging kind of context, or even though these seem dissimilar, if I was an athlete and I was using it, there I would focus much more on full body application, and um, I would certainly apply it at least once a day. The higher your demand for relief is, the more advanced of an athlete, like the harder you're training, or the more you're dealing with challenges that are, go along with aging, then you're looking at putting it on certainly more than once a day. And, we have people that notice if they do it less than even 4 times a day for a full body application. So it really kind of depends. I'm hesitant to just say the maximum dosage on the maximum amount of body surface area all the time. I think it makes sense to be a little bit more conservative because it's not free, but it really helps. So when you have an issue that is whole body, you absolutely want to put it on your whole body. And when your entire body aches, when you're sluggish, you have fibromyalgia, um, a, a full body topical analgesic is it's the perfect thing to apply. What do you have to add, Chad?
Can you ever put too much on? Like, is it going to get to a point where it's just not really doing anything? Could you ever go and put more on where it has some type of a reverse effect?
No, definitely not. I mean, based on what's in the scientific literature, Trent, there doesn't appear to be an upper limit to carnosine saturation. What we've seen up to a year and a half in longitudinal studies, there's still an increase in carnosine within the tissue through oral supplementation, which, as Tim mentioned, is very suboptimal with a high non-responder rate. And so, based upon what science is available, we do not believe that there's an upper limit or that there can be too much available. And the beautiful part of it, as we mentioned, it's a dipeptide. If there ever was a scenario where there was an excess of carnosine, which I can't even fathom biologically because of all the things it can be used to do in a small space, it would simply break it down into its two constituent amino acids and use them in other pathways. And so there's really no risk. I mean, there's no documented side effects in the medical literature for anything that's in the formulation. The ingredients are all from what's called GRAS, or generally recognized as safe from the FDA. And so we have a very good relationship with the FDA. We have the regulatory framework in place from the FDA as an OTC painkiller, as well as with Health Canada for the non-menthol product. And so those things give people great peace of mind. You combine that with the fact that we have those five scientific research studies that prove it gets to the skin, prove it gets into the muscle, and then the outcome-based studies to show what it can do on human performance. You combine that with the safety and the comfort of knowing that this is a highly regulated and safe product via the FDA and Health Canada, and it's a no-brainer for anybody that's looking to avoid some of the pitfalls that can come with pharmaceutical, or they're with a lot of these conditions that people deal with on a daily basis don't have an actual treatment. They have off-label drugs with a ton of side effects, like a fibromyalgia or something like that, where they're just giving you, Lupron or whatever, and it's just wreaking havoc on your body in all these different ways, and then having maybe a 3 to 10% efficacy on the actual symptomology, which is nuts, versus the kind of things that people are reporting back to us in their testimonials and what's been observed in the scientific literature with carnosine for improvement in quality of life and general health and wellness throughout a multitude of different conditions.
So I did want to add a couple of things because I've been keeping my eye on the chats, and I want to reiterate that we're a little bit limited in terms of what we can talk about specific diseases, right? So there are a lot of questions. Can it help with this disease? Can it help with that disease? When I was talking, I mentioned fibromyalgia. I didn't talk about treating fibromyalgia, but fibromyalgia is a condition where pain is a hallmark. And we are allowed to talk about the intersection of LactiGo and conditions that have pain as a hallmark. So as time goes on and we're able to publish additional research studies, the ability for us to talk about some of these other disease states in a broader context than simply remediating pain will absolutely approach those things. But we literally can't talk about, no matter what no matter what kind of feedback we've gotten from users, no matter what the mechanistic plausibility is and what's been shown in research for carnosine in general, we still can't apply that and say LactiGo can do these different things. So I'm going to have to apologize that like all those types of questions we can't answer. We're restricted from answering. We can answer them. We're restricted from answering them. And then I saw another question. It talked about how if you apply it and it goes into the bloodstream and gets transported to a different area, wouldn't you face the same problem? That is why the opportunity to apply topically is so amazing, because you can put it anywhere that you would want it to get transported via the bloodstream, right? So you can do a full body application in 10 or fewer pumps, your entire body. I saw somebody else ask, what is a full body application? You're talking basically neck to feet. right? And some people will even put it on their scalp. You want to keep it away from your eyes. There are carnosine eye drops, totally different concept. Um, you don't want to put it in your mouth or nose. So we do have people that will, rub it on their face. But typically, we're talking sort of neck down if you're trying to do a full body application. And then you're not concerned at all about getting into the bloodstream and getting broken down because that's not even something that you need to worry about. You're actually putting it wherever it needs to go, right? Literally, the only place that you're not putting it is inside your skull, and your brain has tremendous capacity to keep things out. So even if you take oral supplements, many of them don't make it to the brain. So yeah, I would say your ability to put it anywhere on your body and have it be effective versus take a pill and have it basically dissolve into nothing. That's really one of the major strengths of a product like LactiGo.
And also,
On
let
that,
me just add to that, Trent, real quick.
yeah, please do.
What the limitations that Tim speaks to exist for anybody that works in the pharma space and biomedical research. We can thoroughly discuss what we've evidenced through our own research studies, which we do all the time. But the beauty of it is that, as I mentioned earlier, there are thousands of studies that have already been published. So, Google Scholar, MedX, even simple Google, a lot of the conditions and things that I see in this chat as questions there's a lot of good information that already exists. So if your curiosity is unable to be satisfied by what we discuss on the call, please, by all means, do the research and see what we're talking about. Don't take our word for it on the studies that exist and all the different things we're saying. Look what exists out there as the evidence because it is vast. And so I just want to make sure that we're clear. There are things that we can and can't talk about, but there is also an entire body of evidence that is out there supporting all of the things that we're discussing.
Thanks, Chad, for that clarification. This question, maybe I'd bounce it to Tim, but honestly, Chad, the two of you, thoughts from both perspectives on this. When we talk about this delivery system of being able to run this topically versus like a supplementation, do you have like any details or any statistics or data at all that shows? I mean, we're using two key ingredients, carnosine and magnesium. We haven't talked much about magnesium. Tim, I know you're a huge lover of magnesium and understand it in a deep way. But maybe let's talk about our delivery system of those ingredients versus just regular supplementation. Any thoughts on that or anything you can give us, elaborate on?
Well, yeah, sure. A couple of different things. As I just mentioned, there's literally thousands of studies published, and that's not hyperbole, you guys. There are. And what's unique about what we have is that if you look at those studies, and you can take, when they take oral beta-alanine or oral carnosine to try to raise the levels in the body, it can take them 6 months or longer to be detectable, those results detectable in muscle biopsy. And the percentage increase that you see in 6 months to a year, right? We'll call it, let's say, a 40 to 60% increase in about a year's time. We can do that in an hour. And that's what our research studies show is that within an hour's time, this gel can traverse through the skin and be delivered into the tissue at a very high percentage, anywhere from 50 to 300%. If you look at the human and the thoroughbred racehorse muscle biopsy studies that we have that are published, that's the percentage range. And, to be able to do that after one application, that's the other thing is that people are taking oral carnosine literally daily in high doses for 6 months to a year to see results. We can double or triple what they are able to do in that year's time in 1 hour with one application. I think that speaks volumes about the uniqueness of the delivery system, the technology, and why we have the patents that we have that Tim and I authored. It's basically two patents. It's both a human performance and a biomedical patent. And so yeah, I mean, it's novel. I would also say, in the last 30 years, there has only been one new topical that has been introduced to the market, and it's us. And there's only a total of 17 that exist and that are approved by the FDA. And all of those other ones are primarily topical pain, which is like a pharmaceutical drug and or hormones. And a lot of it's patches and a lot of it requires like a syringe or a needle even. And so, we're very unique in that we come to the table as a non-toxic analgesic that has all these other potential benefits in the human body, and you don't have any of the downsides that come with all those of other type of products that exist both orally and even transdermally. And so yeah, I mean, we're super unique across the board, and we're a disruptor as a result of that. And we always say that, we've had to forge our own path throughout this entire time because, normally you can come in and ride coattails and follow somebody else's trail, but we've had to carve our own because there just wasn't a space where there was products like us that existed. It wasn't just the fact that it's carnosine and magnesium. It's the fact that it's a topical I mean, that in and of itself is very difficult to bring to the market. And then to bring one that delivers something that had not been delivered before in that size, you know, that is another thing that makes it unique on top of all of the things that we already discussed is that carnosine is a hydrophilic molecule and our skin's lipophilic, so the traversing through it is not very, very easy. And in the world that we live in, the molecular weight is how we judge something's potential to go through the skin. And its molecular weight for a hydrophilic molecule is extremely large. And to our knowledge, we were the first ones to put a hydrophilic molecule of this size through the skin. It had not been done before. And so, that was the challenge that we had to overcome with this product and what Tim and I have spent years trying to make improvements and looking at the next steps and where and how we can take this and further it. And so I think, those things are all each individual kind of milestone is something that a company could hang its hat on. And we've got, more a list of those that runs 12 deep.
Tim, with your extensive understanding in nutrition, how significant is that when we talk about this delivery system and where do you see this going? Like how big would this be moving from just supplementation to where we're actually applying this topically?
I mean, I think it's amazing for a couple of reasons. The main reason is it gives us access to carnosine for for the first time. I mean, there's the only other way that anybody plausibly had access to carnosine was through beta alanine supplementation, which just has a host of issues from a really high non-responder rate. So the number of people, there's a large number of people, like really large number of people that take beta alanine and get no benefit. But you have to load that. So you're taking it for weeks and weeks just to figure out whether or not this is something that's going to help, get carnosine into your tissues. For people that use LactiGo, it's usually they have something going on. They find it, however, they know somebody, they saw it somewhere, they buy it, they put it on, and within 20, 30 minutes, they're like, oh my gosh, this is for me. Like, how much more difficult is it to have something that you have to remember to take multiple times a day for weeks that causes side effects like tingling, paresthesias, and then you don't even know. Like, it takes so long when whatever it is that you thought you were taking it for starts to get better. Like all of us have been in that situation, right? You hurt your back, and then a couple weeks go by, and you're like, my back feels better. Well, did you do something to make it better? Was it the supplement that you started taking, like your curcumin supplement? How do you know? You have no idea. When you have something like LactiGo that works as fast, as immediate, penetrates as quickly, demonstrated in research that like this actually happens in addition you being able to feel it, it's a game changer. Like you no longer are second guessing yourself. Did this really work? Right. That's one of the beauties in or one of the challenges in nutritional medicine and one of the beauties of LactiGo is you're always wondering, did this work? Like, I don't know how many of you took fish oil today. I took fish oil today. Did your fish oil work today? I don't know. I don't know if my fish oil worked. I know my LactiGo worked because I can feel it. That's really where a lot of the benefit comes from is and then what Chad talked about in terms of the delivery system, the fact that we have something so powerful, it offers a lot of opportunities, both with versions of this product that we have now. Like, we originally didn't have menthol in it, and then we added menthol, so now we have two different versions. But the number of permutations of the concept that we have currently in the LactiGo product that are possible that Chad and I are working on literally every day as we're doing R&D, you'll be amazed. And I don't say you would be amazed, you will be amazed because these things are constantly in the works. We have I was almost late to the call. I got on right at 9 o'clock because I was preparing an email to a lab that's testing 6 different products, and that's like a day at LactiGo is pushing and testing to make sure that what we have actually works, that it really penetrates the skin. It actually does what it is that we say. We don't just throw a bunch of stuff in a bottle that you could Google random research on and say, hey, it must work because there's a random paper that says this. We put the work in advance in terms of thinking about these things. Then we do the testing, and then we do testing, like beta testing with users to check and see if something works. And if it doesn't work, we go back to the drawing board and reformulate. We've had things that we tried that didn't work great. We go back and reformulate them, and you wash, rinse, repeat. But when you get something from LactiGo, it is going to be the best version of whatever it is. So right now, the LactiGo gel is the best version of a topical that you can get and of an oral. Um, and all the future stuff will meet that same level of quality.
Great response, Tim. Thanks for sharing that. So let's talk about just where this is going. Are we privy to talk about where the future of this, what it looks like with this? What kind of products could we see coming out? Are there other ingredients that we know that can run through this type of a delivery? Where do you see this going in terms of our delivery on this?
Well, Tim and I have, we've always tried to have where are we going to be in 5 years, 10 years, and what do we need to do to make sure that when we get there, we're ready. And so, we've consistently thought about how to both improve or take the delivery system and find other ways to use it, which we've worked really hard on. There will definitely be new products coming to the table. Over the next couple of years, we should introduce new products. I would say, annually there would be something that you would expect to see from us, where we can find and recognize gaps that exist in the way that people are addressing things that they may be dealing with, whether it's vanity, whether it's their health. We're looking at anything and everything we can where our delivery system can improve upon what's there or just be utilized in a place where there currently nothing exists. And so, we look at it as basically the limit is our creativity. We're only really limited by our creativity and what we can do. I mean, obviously there are certain confines we have to follow, but we're really excited about all the different products that we've been working on and developing, and from cosmetics to whatever. And I think that we would have never envisioned doing this, even with our forward thinking. And so it's super exciting for us because, this is really just the beginning for the science team because, we've got this product now that is performing well, and we've really kind of cracked the door open to this new frontier on what we're going to do with it that we really didn't know was there, even a year ago. And so I think it's almost like a reset for us. It's almost like 2014 again, reboot. And so you can only imagine the disruptors that Dr. Sharpe and I are going to be in the pharma space, because look what we've already done. And I can definitely say that the things that we're working on right now, are significantly more disruptive than what we've done this far. And so, with that being said, I think that's pretty much what I have to say about it. Sharpie, what do you got?
So there are a couple different categories when you ask a question like this. One category is we're constantly looking to improve what we already have. So when I mentioned that I was preparing an email to a laboratory where we're getting ready to do a bunch of testing, most of that testing, not all of it, but most of the testing that we're doing, it's multiple samples, is different versions of the exact same thing that we have right now. So we can see, do any of these outperform? So we actually, even though we have test results the on the LactiGo product itself, in order to use that as a baseline, we're actually paying to retest it so it's done at the exact same time as some of these other ideas where we'll tweak this or tweak that, just change things up, all to see what's going to be best. And then when we discover something that's better, we just improve the formula. So that's one side, is we're always looking to take what we're already doing well and do it better than well. The other side is, this is really a delivery technology. We talked about the carnosine magnesium, and when you have a potent delivery vehicle like what we have, this patented delivery vehicle, the question can shift to, what else can you deliver? And that's where things get really, really interesting. We come up with what else can we delivers all the time, and sometimes we're constrained by things like, it's impossible to source because what we're trying to do is so novel. So we're having to look to see, is there even a place where we can get the ingredients that we want to do? Some of these things only exist in research labs. So we use our imaginations, and then we have to settle with the reality of what is physically possible to do. And a lot of the really interesting stuff that we have pending, it's not pending our intellectual development. It's pending whether or not the rest of the world can do what we're asking of it. And so we're waiting on a bunch of emails to know whether or not we can press go on products that we literally have already formulated, but they need to be able to source them at the level that we know we would end up selling, because this company is just such a rock star company for being able to get stuff into people's hands. So that's the thing, is we think of it, and then we need to be able to make enough of it so you guys all have access to it.
Love it. Thank you for that, Tim. Chad, anything else on that one?
No, like I just said, I just want to reiterate, like, you guys ain't seen nothing yet. I mean, trust me, the stuff that we're doing now that we have on the horizons is gonna be, I mean, we will be a household name, um as something that changes people's lives, and also was a disruptor in a space that a lot of people are disgruntled about. We're talking about the pharma. And so, yeah, you guys ain't seen nothing yet.
Yeah, literally as recent as like 2 days ago, where we came up with stuff. We're like, oh my God, we never thought we would think of something like this, and we're already like formulation ready, just to our suppliers. Can you get this? And including sending them messages of these are 5 suppliers, but can you get enough of it? That's kind of where we're at. So this is you ain't seen nothing yet is it couldn't be more true.
Well, what definitely gets us giddy is you can see the hearts and all the emojis that are coming up. When you sit at this intersection of innovation and just our unique way and how we can move ingredients and the evolution of products that are coming, it makes us all excited because we're sitting in front of something significant. And there's just the timing and positioning to this, as you talk about, Tim, like you guys are spending the time in the research laboratory, and we're just salivating to be able to get this out to the market and excited about that evolution as it goes. So we definitely appreciate that. Now, I will tell you, my phone has been blowing up, and I probably wouldn't survive the rest of the night if I don't ask a question about the equine line. We're excited about the fact that Velocity has come to the market and that it's here. Can you shed maybe a little bit of light on Velocity? Um, maybe why did we start even doing some research on horses? Was there anything significant there? And then maybe a little bit of your guys' perspective on that. Tim, I know you've got a lot going on there in the velocity world as well. Is there anything there you guys can elaborate on or talk about for large animals and the equine line?
Yeah, sure. I mean, we published a study on it, and so I mean that's something we're really proud of. And Tim and I were co-authors on that. And it's essentially the same thing we did with the humans. We did thoroughbred racehorses, the best of the best. We did muscle biopsies after applying the gel with no prior use, a double-blind, placebo-controlled. And what we saw there was anywhere from 100 to 300% increase, as I mentioned earlier in the call, after one application. And so again, we were really blown away by that. One of the main reasons why is a lot of other animals rely on carnosine even more so than humans, and it's more difficult to increase the levels in their skeletal muscle. Thoroughbred racehorses are a perfect example of that. And so for us to be able to achieve those type of results there is actually more impressive than us doing it in humans. And so I personally feel like that is probably some of the strongest evidence we have because it is so much more difficult than what you would face even in humans, which is a pretty insurmountable challenge by itself. The other thing I would say is there's two parts to what it looks like when it's actually utilized with these animals. The first part is the performance. And those that are unfamiliar, the Velocity product has been used by the best trainers like Bob and those guys in those stables and has won multiple Kentucky Derbies. And the two Kentucky Derby winners were the second and the third longest shots in Kentucky Derby history to win. And in 2021, which was, I think, the second longest shot in Kentucky Derby history to win, LactiGo Velocity um, um, users placed one, two, three, four, and five in the Kentucky Derby. And then 2 years later, the Kentucky Derby was won again by a velocity horse. So the performance is similar to what you see in the elite athletes. It definitely elevates them to another level. I think what I feel the best about, and I think what is even more important is the amount of inflammation those animals are subjected to just from what we would call training or practice to get ready for races is substantial. It's almost like a car crash happened to their body. And the mitigation of that inflammation that was visible on the MRI and some of the imaging that was done during the course of this research study is incredible. And it surpasses anything that I had seen, even from what we're doing elsewhere within humans. And so, those horses don't have a very good quality of life. And so for me, I feel good about the fact that any animal that's going to be exposed to that gel is going to have a significantly improved quality of life and reduction of the stressors that come with being a high performing athlete, animal that's an athlete. And I would expect that to extend to all kinds of different, athletes that perform like, there's distance riding, there's all the jumps, there's all kinds of different ways that horses are utilized. So it's not just that, not just the sprint stuff. So, and you take that and you cascade that down to the other animals and the potential there for the benefits of what carnosine can do within the body are the same. You just have this ability to help them have way less stress in all the different tissue spaces and joint capsules and all the things that animals are affected much differently by gravity than we are being bipedal, and people don't even think about that stuff. And so yeah, I think it's a fantastic product, and um, I would argue that it is the only thing that exists in that space that is doing what this is doing. And it's a very tightly regulated space, and so for it to be again a clean, safe, natural product that can be used there is unmatched. Sharpie, what do you got? Because I know this is kind of a little bit your world.
Yeah, well, I grew up in Kentucky, and my dad had racehorses. My mom had just a riding horse that all of my nieces and nephews would ride. So anyway, yeah, for sure, horses are they were never my thing personally, but I was always around the culture. Uh, in terms of the product and product development, because that's some of what you were getting at, Trent. As always, we can't ever like really sure exactly what we're working on, but I will tell you that one of the things that we are working on with Velocity, in as generic a way as I can say it, is uh, enabling application to horses to be simplified. So I can't tell you more than that. That's one of the things that we're looking at doing, is making it easier to apply. Um, and we also, to that effect, that is one of the things that we're doing testing on to make sure that any changes we make actually are still efficacious, because we don't just throw a wrench in because, hey, this sounds like it would be cool. If we make a change, it's because it made sense to make that change, not just from we had an idea, but we execute and we verify. So the Velocity product is something that is actively researched behind the scenes. You just don't really hear about it because we don't talk about those things. But it is in the mix along with lots of other things that we're doing. And just like F1 racing, all the advancements they make in those ultimately find their way into the cars that you and I drive. Anything that we do on any aspect, we're always looking to see where does it filter over. So if we discover something amazing on the velocity side, then we look to see, hey, can this filter over? But vice versa, anything that we discover on the human side, if we're looking at um, different concepts of formulations, we look to see where can we apply it like all together, and then we'll do a bulk upgrade if we find something that makes sense that it would improve, you know, 4 of the 6 products that we're looking at. We'll immediately just go ahead and implement that because we'll already have the testing. We already know. So the larger this company gets and the more products we have, when we make improvements, it's going to be remarkable because the improvements will just sweep over, a huge swath of what we have available, and there will be a lot available. Chad had mentioned, we have we think 5 year, we think 10 year, and over the next couple of years we'll have things. We're being conservative in terms of what we will have in the medium future. That's as specific as I can get because people will expect to drop next week if I'm more specific than that. But I, if if we didn't have some amazing things to offer to you in 2026, I would be shocked, like absolutely shocked. So keep your eyes peeled. And some of what we offer may even almost be transparent because some of it could just be LactiGo just magically gets better, which is hard to believe that there's room for improvement. But we're always looking for that, extra few percent or 10, 20%, whatever we can get, we'll take it.
Tim Sharpe said it right here on this Zoom. We got some exciting stuff coming. We sure appreciate both of you. In closing, I just want to ask you each the same question as we wrap up. You guys have got a deep resume and a lot of experience, and you chose to be here with LactiGo. What excites you the most about being here? And by the way, may I say on behalf of everyone that's here, we're grateful that you made that decision to be here in LactiGo and be putting your efforts and talents into this. With that, what excites each one of you individually? Chad, we start with you, and then Tim, maybe to close up just that question. What excites you the most about being here, and why did you choose to be here?
Yeah, I think, intellectually it has been, very stimulating scientifically to be able to combine all of my skills in one place. And I think professionally, I had spent the last 25 years preparing without realizing it to be able to do what I'm doing now once given the opportunities and resources. And so, that's what I'm most excited about, is that I'm able to do that. And, we're going in on from 11 to year 12. We're not a flash in the pan. We've been doing this for a really long time, and we've been consistently hitting our benchmarks and producing IP and value for this company. And, I think that when you combined all of that together with the number of lives that we're changing, that's where the satisfaction comes in. And, knowing how many people's lives we've already changed and will continue to change. I mean, that's not something that you can buy with money, that feeling. And so, then for me, the last and final piece would be that with this model that we have, I'm looking at all these participants from this call. All of you guys are the voice of our work, as I've continued to say. And so, that really excites me, because now, after 11 years, we finally have all these megaphones that are talking about what we've been doing. And so, that motivates me and Tim to continue, what we've done and to push this to levels that we didn't even think were possible. And like he said, you will see that in 2026. Just wait.
Thanks, Chad.
I don't want to repeat a bunch of stuff that Chad said. Obviously, those all are drivers for me. I'll say probably two important things for me. One is this company really gives us the ability to spread our wings. If Chad and I decide we want to do something, they just say okay, right? I mean, we're smart enough. We don't try to do things that are ridiculous and that there's literally like it would take $15 million to develop that product. That's something that we'll do 5 years from now. But if we have an idea for a product, regardless of the product category, if Chad and I say we can do this, they say okay. And so the breadth of concepts and what products we're looking to bring to the market it's crazy. Like every category you could imagine and several that you would never imagine, those are things that we're actively looking at and developing, and then we'll test, and maybe we'll find 3 of the 5 were fantastic, 2 need some work. But this company allows us the freedom to do that work and to try to find ways that we can improve people's lives. So that's the one thing. And the second thing is I get to work with the people that I work with. I mean, Chad and I have been best friends for years, and we get along great with everybody. Like we're friends with like the whole management team. Like if we get on a call, we have to stay focused. Otherwise we could just talk for an hour and then realize that we actually had an agenda. So when you have a work environment where you're working with people that you actually genuinely like and have your back, you don't have to worry about stuff. I mean, I don't know. I can't think of a job I've ever had where that was, that was actually true. And like Chad said, this isn't a flash in the pan. I mean, we've been doing this for over a decade, and it's the same. Like if it wasn't true, we would know by now. So that's the team and the freedom, I would say, are the two things I would add.
Thank you, Tim and Chad. We truly appreciate both of you for the amount of time and effort that you have put into this, the decade of time of all the research. And I'll use the words that you had said, Tim: sky's no limit product, truth matters, category creating. These are really powerful statements that Tim has made on some previous calls. And then Chad has made this comment, and he just echoed it again tonight. You are my voice. We're not going to let your guys' work go silent. It's not going to be locked up in a box. You have a commitment from hundreds of affiliates that have joined us on this call tonight to let you know that we are going to be a voice to share this. And we're grateful for the opportunity that we have to be a part of this. And I would like to just give a challenge and an invite to any guest that's been on here getting the information about this product. If this resonates with you, I'm going to challenge you to do two things. One, try it. Put this product on and experience it for yourself. And number two, seriously entertain joining this mouthpiece, this voice and a community of people that have come together to share this. We believe this is going to get out to the world. And as you heard Tim and Chad talk about the evolution of this type of a delivery system being used in more than just what we've got with these two ingredients, this will be something significant and powerful that I believe will change the conversation of how we're addressing quality of life. You could be a part of that movement with us as well. Join us in this movement. There is a reason why the owners chose this distribution model. And the reason why is because the experience that we have when you share it and experience it and have a community of people coming together like this, this is how this product is going to get out to the market. It's not going to be sitting on a shelf collecting dust. It's going to be the mouthpiece of all of us coming together. So if you're someone who's getting this information for the first time, we invite you to be a part of this journey with us. Get back to the person who shared this link to join us, experience the product, and experience what Tim had said, the freedom and liberty that comes from being a part of this type of a movement. It's a special, beautiful thing when you put this together with a unique opportunity and a compensation plan that we can share with you that gives you choices. So with that, we'll close this call up. Tim, again, thank you for your time to join us here tonight. Chad, as always, yours as well. We love the science engagement. And as Chad puts the flex up there, we're going to invite everybody. Let's finish this up with a little bit of flex and a couple of jab hits. We appreciate you guys for being on here and the excitement that comes along with learning about the power of this product. Thank you for being here tonight. You guys have a wonderful rest of your Thursday night. And those of you that are interested in learning more about the compensation plan or what we do on building this business, we are going to be unveiling how we get started this business this upcoming Saturday at 8:30 a.m. Mountain Standard Time on the same link that you joined in on this. That's welcome to everybody. With that, we'll close it up. Until next time, have a wonderful evening, everybody.